It's so overwhelming and it's so confusing and it changes. And I think most of us don't really know what we're doing. And so that ends up leading to frustration. And honestly, practitioners do one of two things usually. One is they'll say, I don't like to, it's too hard to think about all this stuff. I'm just going to focus and be an expert on one thing. And listen, I totally get this. In fact, I've done this. Maybe you're a toxin expert. Everybody's toxic and everybody needs to detoxify. Anybody that comes into your office, for any reason, you put them through a detoxification program. Totally cool. I get it. Maybe you're the adrenal fatigue expert or the thyroid expert or a brain expert or a diabetes expert or whatever it might be, PCOS or menopause or whatever it is. I get it. It makes things a lot easier, but if you're really honest with ourselves about it, we know that we're not helping everybody because everybody's not a thyroid problem or everybody's not a brain problem or whatever it might be. The other thing that we do, and I did this too, is you say, well, I'm confused at all this information, all the articles, all the podcasts, all the things that are out there. I'm going to go to an expert and go to one of their seminars. And so you do. You go to a seminar, let's say on the brain, and man, they present study after study after study showing you how the brain runs the gastrointestinal tract and how the brain actually runs the thyroid and it runs the liver and it runs the immune system. And if any of those things are dysfunctional, they point to some really great papers suggesting how the brain might be responsible. If your immune system's in balance, look to the brain because the brain influences the immune system. And you leave those seminars totally charged up. This is awesome. I must be an expert in the brain. I must figure out how to evaluate and assess the brain and neurotransmitters and learn how to give neurotransmitter support and different actions. I'm going to be a brain expert because clearly all these, what they presented, I'm failing my patients. I'm failing my thyroid patients. Maybe it's the brain. I'm failing my gut patients because maybe it's their brain in the first place. And then it turns out that you do some of these things and it doesn't help people the way they kind of presented during the seminar, which is fine. So then you decide, well, I'll go to a gut seminar. And guess what? Study after study after study is presented of compelling evidence that the gastrointestinal tract and the health of the bacteria actually runs and dictates how the brain functions. You're like, well, wait a minute. I just went to a seminar that said the brain dictates how the gut functions, and now you're telling me that the gut, and showing me studies on this, the gut is responsible for things like the stress response in the brain and certain behaviors. And then you also see that the gastrointestinal tract, if dysfunctional, leads to fatty liver. And the gastrointestinal tract is 70 to 80% of the immune system, so if your immune system's in balance, it's not the brain, maybe it's the gut. And if it's the gastrointestinal, it also influences the thyroid. You're like, wow, I thought it was the brain, but this new evidence on the gut, clearly it's the gut. The brain's confusing, so maybe I'll just focus on the gut until you go to the thyroid seminar.